Hi guys, how are we doing today? I hope we're doing all right. So today we're going to be talking about ear infection in children. What is ear infection? What are the signs of ear infection? What are the symptoms of ear infection? How do we treat this ear infection? When should we call a doctor? What should we even expect from a doctor? All of this we'll be discussing today in this video. I believe you don't want to miss out on any part, right? So stay glued till the end. So dear parents, do you know that ear infection are one of the most commonly diagnosed illnesses among children all over the world? In United States, for example, it is said that 23% of babies before their first birthday had at least one ear infection, and more than half of the children had at least one ear infection before they turned 3. Ear infection is very common in young children and babies, especially when they had cold or flu. I know someone might be wondering, ear infection? What's that? What does it mean? Well, ear infection is an infection in the middle ear. Although there are different types of middle ear infection, but there's one among children and it's called acute otitis media. So the thing is, when fluid is trapped behind the eardrum, it makes the middle ear become swollen and infected. So this is why you see children, they feel pain and they develop fever. So what could cause ear infection in children? Like I said, ear infection is very common in children, and this is because of their small eustachian tube. So this ear infection is caused by bacteria or virus, and it's usually after an illness, like I said, when they've got cold or fluid. So because fluid can build up in the middle ear, so it allows the bacteria that have traveled to the area to multiply, and this causes ear infection. So ideally, the fluid that enters in this area, they get drained quickly through the eustachian tube, and this connects the middle ears to the back of the nose and throat. So when an eustachian tube is blocked, because it usually happens during cold, the fluid gets trapped in the middle ear. And we all know that germs like to grow in dark, wet, and warm places. So a fluid-filled middle ear is just like a perfect place or a perfect zone to make this infection to get worse. Again, the inflammation in and behind the eardrum also increases, making the condition to be more painful for children. And this is why they tend to develop fever and their body fights the infection. Another thing to note is that the use of pacifier, you heard me right, pacifier may increase the ear infection. So according to research that was carried out, it says babies who didn't use pacifier were 33% low of ear infection. So now let's see the signs of ear infections in babies and children. One easy way to tell that your child may have an ear infection is simply by you observing them, their mood. So you need to check, are they crying more than expected? Do they have fever? Have they got a cold or a flu? Because ear infection usually comes after a cold or a flu. So now let's see the symptoms of ear infection in babies and children. One is they tend to pull their ear. When you see them frequently pulling their ear, some of them lost appetite. They find it difficult to sleep. They tend to vomit, and some children have diarrhea. When they have ear discharge, or when they have unpleasant smell, when they have fever, a cough. Let's see treatment for ear infection in babies and children. So basically, ear infection treatment is dependent on the age of your child and how serious the infection is for your child. So most doctors would prescribe antibiotics for children whose infection is severe and for children who are under 6 months. So while for older children whose cases are not so serious, they may be asked to wait for 2 or 3 days. So ideally, ear infection clear up on its own after a couple of days. Or some doctors might even prescribe painkillers to reduce the pain for your child. But it's usually advisable to keep eye on your child, and if they don't get better in 48 to 72 hours, it's important to call the doctor so the doctor can consider maybe giving antibiotics to your child. Now, let's say why doctors do not easily prescribe antibiotics for ear infection in children. So when it comes to prescribing antibiotics for children and babies, doctors are very careful. And this is not because they don't want your child to get better or they want your child to just be in pain and all of that. It's just simply because bacteria is getting resistant to your child's ear infection. And also, in addition to the antibiotics resistance, doctors understand that giving your child antibiotics medication kills the good bacteria. And these good bacteria are essential for keeping digestive tract of a healthy child. Another reason why doctors they don't give it out is because ear infection is caused by bacteria or virus. Again, antibiotics it doesn't work against infection, so doctors are very careful prescribing antibiotics for a child. So tell me, what's your takeaway from today's video? Ear infections are common and painful conditions that affect children. By being aware of the signs and symptoms, you can ensure your child's health and well-being. Again, if you suspect that your child has an ear infection, please call the doctor. Have your child ever had ear infection? What were the signs? What were the symptoms? How did you treat it? What did you do? Did you use antibiotics for them, or did you leave them to stay for a couple of days, or did it just heal naturally? Please share all your thoughts down in the comment section. Please like this video and share it so other parents can see it. And remember to subscribe to this channel if you haven't done so. And also remember to turn your notification button on so that whenever I upload a new video, you'll be the first to see it. My next video, I can't wait to see you there. Bye bye.